Welcome to Archmaker. This is Dr. Po Raval, board certified podiatrist for over 35 years. Today we're going to talk about what causes numbness in a nutshell. So number one, spinal issues. We've all heard about sciatica, comes from the lower back. Those are your spinal nerves as they travel through your legs. So from the hip down, they then bifurcate in the foot and cause pain in the foot and ankle with lesser nerves. So spinal issues, number one. Number two, diabetes. So diabetes, remember, high blood sugar. You should always get checked by an endocrinologist with a basic blood test to see if you have high blood sugar. And hallmark signs are neuropathy in the tips of the toes is where you get diabetic peripheral neuropathy. Number three, lack of B vitamins. This is something that's missed all the time with your blood test, your basic blood test. The B vitamins should be checked. Usually a injection of B12 on a regular basis can help neuropathy symptoms. This is usually done with your primary physician or your endocrinologist if you are diabetic. Number four is poor blood flow. Always checked on a routine exam. We check it as a podiatry office. It should always be checked at any of your primary care offices. If there is poor blood flow, first of all, poor blood flow, you would see like a blueness to your toes or within the leg. We normally check blood flow by doing a Doppler test, usually done by a vascular lab or by cardiology. They will check your blood flow and see if there's any kind of blockage. Remember that the arteries and veins run alongside of a nerve. So if there's lack of blood flow, it will affect the nerve. Next, Morton's neuroma. So Morton's neuroma is when you have two nerves that are rubbing against each other and they form this big conglomerate. And that conglomerate causes numbness, burning, tingling. It is usually the third interspace in your foot. And there are two other signs besides the symptoms. Sometimes you can actually feel the nodule, it clicks. And the last thing is you get this thing called a V sign, that it's so big that it's now separating the toes. Believe it or not, although you can surgically remove this, what's preferred is that we do injections, ultrasound, injections of salt solution also do help. And physical therapy actually helps to break that up as well. And lastly, autoimmune diseases. So there's a basic blood test called an autoimmune blood test, and it has a lot of arthritides and other autoimmune issues that can cause numbness. So when you get your basic blood test, always note and tell your physician whether you have neuropathy, and you should always be getting a basic blood test to see if you have high blood pressure. You should always be checking your B vitamins, and you should always be checking for autoimmune diseases. We usually send people over, if they have an abnormal blood test, we send them over to rheumatology, who's equipped to handle these issues. So these are all the causes of numbness. What do you do about them? So number one, obviously control blood sugar if you're diabetic. You want to go to a pain management or orthopedics for spinal issues. Your endocrinologist or internal medicine for any abnormalities on your blood tests. Blood flow vascular surgeon or a vascular specialist or your cardiologist. And then finally, rheumatology for autoimmune. Besides that, physical therapy definitely helps the symptoms. For Morton's neuroma, wider toe box in your shoes. And we often treat with orthotics to offload the areas that are bothering you. Hope this helps. Believe it or not, also keeping warm, keeping your nerve warm and blood flowing definitely helps neuropathy symptoms too. Hope this is all helpful, and stay tuned. Welcome to Archmaker.